Hello, my name is Hannah Gracie. I'm a fourth-year health science student, and today I'm going to discuss my undergraduate honors thesis project, which I completed as a student researcher at the Southern HIV and Alcohol Research Consortium, otherwise known as the SHARC. There, I studied the association between sleep and cognitive function in people living with HIV. This topic of study is significant because people living with HIV are disproportionately impacted by cognitive impairment. In fact, the incidence of mild to moderate forms of HIV-associated neurocognitive disorders are estimated to be as high as 50%. As cognitive impairment impacts people living with HIV, their caregivers, our national systems of care, and our economy, we need to investigate ways to reduce the incidence of cognitive impairment in people living with HIV. Sleep problems are also very common in people living with HIV. Prior research has indicated that the prevalence of sleep disorders in this population could be as high as 81.4%. Additionally, many studies have established that there is an association between sleep problems and cognitive dysfunction. As this relationship has been well established in the general population, our study sought to determine if it also existed among people living with HIV. To do that, we performed a cross-sectional analysis using data previously collected from 274 participants by the SHARC during the Marijuana-Associated Planning and Long-Term Effects Study. Our outcome of interest was cognitive impairment, as measured by the NIH Fluid Composite, which is a common tool used to measure cognition. Our exposure of interest was sleep quality, which we measured using 3 questions taken from the Pittsburgh Sleep Quality Index, or PSQI, which is a well-validated tool used to assess sleep quality. 265 participants were included in our final analysis. We found that sleeping between 5 and 6 hours per night was associated with 2.89 times increased odds of cognitive impairment. Interestingly, low income status was also associated with 2.88 increased odds of cognitive impairment. PSQI questions 6 and 8, which measured subjective sleep quality and daytime sleepiness respectively, were not correlated to the outcome, so they were dropped along with other variables. In summary, our results indicate that people living with HIV who spent between 5 and 6 hours sleeping per night were more likely to be classified as cognitively impaired. This is a significant finding, as clinicians could use these results to modify the sleep health of people living with HIV who are at risk for developing cognitive impairment. Of note, our study was limited by a small sample size and the use of only 3 of the 10 PSQI components. In terms of recommended directions for future research, we suggest that future research investigate the possibility of a causal relationship between poor sleep quality and cognitive impairment in people living with HIV. Additionally, there is very little existing literature that evaluates sleep interventions for people living with HIV, so this would be another worthy area of study. I hope you enjoyed the presentation, and thank you so much for your time.